All right. Well, thanks everybody for inviting me to speak to this. You know, I'm a registered dietitian, and it's kind of interesting that I landed in the world of architects and facility managers and sustainability people, because I certainly didn't get my start there. But I always like to share a little tidbit as to, I think, how I ended up coming into this field of work. As a registered dietitian in the Army, I had the goal. I was going to help people. I was going to, change their lives. I was going to, if they were overweight, I was going to help them lose weight. I was going to correct their cholesterol levels. And, I learned very quickly that it took all of about an hour, maybe a little more, maybe a little less, to explain what to eat or how to eat or how you should exercise or how much you should exercise. And I spent the rest of the time working with people on figuring out how to control their environment. Because often, in fact, many times, my clients were from a health background, and it took very little effort to try to explain to them what to eat, but it was rather exploring, why is your home environment not conducive to being healthy? Why is your work environment interfering with your goals? What are the psychological aspects of why you're doing what you're doing? And I ended up spending more and more and more time looking at people's environments, and I have a lot of really interesting stories that I could share, and I'm only going to mention one. And I think it's because of the discussion with the daylighting. I was at Walter Reed, and I had a sergeant come, and he was just about ready to get kicked out of the military due to his inability to keep his weight in the regulations. And he was very, very frustrated. And after exploring a lot of what he was eating, he had been through the stories of the classes and all that. But it turns out that his office was in a basement. It had no window. He was a supply sergeant, so he was constantly, on his computer ordering things, and he really just never got out from the dungeons. And what that caused is he was very tired, he didn't have any energy, and so then he was eating more sugar, more chocolate, more things to try to boost his energy to get through the day. And so we kind of worked on a plan to get him outdoors. He got issued a laptop. He worked with a supervisor to get out of that office in the basement and was able to get into an environment where he had better lighting. He had views of nature. It didn't matter so much that he had to stay in that little space that he was assigned. And within, I tell you, a couple months, every bit of weight that he had to lose just fell off. It really utterly changed his entire life. And so that kind of led me to think about how important environment is, and that the education piece is important, but really it comes down to the environment in which people are working and living and playing that really impacts their health. So GSA has not necessarily been at the forefront of health and wellness programs up until the point when, in 2008, the president issued a couple memorandums that said all federal agencies should start looking at the impact they can have on human health. And we at the time had an individual at GSA who kind of thought outside the box and actually hired 2 health and wellness professionals to work specifically in facilities management. And it wasn't an HR function like what is often seen in other federal agencies, but specifically looking at the built environment and what we can do to improve the health and wellness of federal workers through that venue. And FitWell was kind of a perfect storm. It came about from a variety of areas. One, we were working on trying to get a handle on our own inventory, which was kind of a silly exercise, typical federal fashion. Make a list of all the wellness amenities you have in your federal buildings. I was like, okay, I can do that. That's not a big deal. But what does it mean? So what if I have a list of what's in our buildings? Some have fitness centers, some don't. Some have great daylighting, some don't. Some have healthy concessions, some don't. But what does it mean? There wasn't any way for me to really create a meaningful metric around just creating a list. So that was something we were pondering. And then about the same time, we started getting trickles of stuff out of Region 5, which is Chicago. And they were working with the Chicago Healthy Initiative. And Rahm Emanuel, who was the previous chief of staff to the president was now the mayor, and he had taken some of the healthy initiatives back to Chicago and was looking at how to create this environment within Chicago that included everyone, from private sector individuals, federal government, nonprofits, religious organizations, and they had a big kickoff meeting that we went to, and they wanted GSA to be involved with that. And then lastly, we were working with New York City on exploring their active design guidelines that had been released. So all of those things kind of came together, and the same individual who hired me basically came to my desk and plunked down the active design guidelines and said, we want this at GSA. Figure it out. And that's all he said. So 4 years later, I'm happy to report that we have done what he asked. He's no longer with GSA, but I actually called him up the other day and let him know that we actually are at the point where FitWell is just about ready to go out the door. So FitWell is a partnership, and I think part of how and why FitWell has gained the traction it has within GSA and across the federal government in an era of very strict budgets is because of it's an intergovernmental and an interdisciplinary partnership. So me, being the only health and wellness individual working in facilities, I felt it was very important that I had support from other federal agencies that did have the primary mission of health. So we reached out to CDC, who we were working with on the healthy guidelines, and they were more than happy to work with us on this project. From their standpoint, this was a huge public health initiative that they wanted to get on board with. And CDC develops really, really great stuff, but they don't always have the vehicle, right, to implement, because they don't run facilities. They run their campus, they run some of their own individual buildings, but they don't have a large presence in terms of facilities management. So they see GSA as a great vehicle for kind of implementing some of the programs they had developed. So they were more than happy to work with us, and then we reached out to New York City and worked with their Office of Design and Construction as well as their Department of Health and Mental Hygiene. We awarded a contract to ICF International to help us in the final developmental phase of FitWell, and they subcontracted with Perkins & Will, and then two industry experts, Andrew Dannenberg and Matthew Trowbridge. So FitWell's vision is to encourage and promote healthy buildings, places, and experiences by rating and certifying health-supporting aspects of building design and occupant policies and programs. And there's a couple really important keywords here. One is experience, right? We really, like the Googlers, want people in our GSA buildings to have a positive experience. And so what is that? What causes someone to walk into a federal building and say, wow, I'm happy to work for the federal government. This is a really great space, versus some of those pictures you saw where you're in the bowels of a basement with no windows and these high cubicle walls, right? So you wanted to change that perception at GSA that you would have a good experience working in a GSA facility. And the other piece is policies and programs. FitWell doesn't look just strictly at the hard-built environment, right? And this was partly because of 2008 we were hired. In 2009 we got our budget slashed, right? So in order for this program to move forward, we had to have some strategies that did not rely on a lot of money. So looking at how a facilities manager actually operates their building, and then the policies that are in place, largely how you communicate with other people in the building. You know, we're the landlord, but we have customer agencies and tenants in our building. What are their priorities for health and wellness? What do they want to see offered to their employees that are working in a GSA building? So our mission really is to create that culture that embraces performance-enhancing, health, and human-centric environments. So this is the genesis, as I already mentioned. And really, when you look at FitWell, it was very, very important to GSA, though I have to admit, you know, the people I work with at GSA are not always versed well in research and literature, because, you know, I work in facilities management. So, you know, these are people who are very, very good at running and operating buildings, but they may not necessarily keep their eye on the literature for health and wellness. So when CDC came on board, they said, you know, look, we're totally into this FitWell project, but, you know, we had a list of like 300 things, and they immediately started crossing stuff off. They were like, nope, 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 no research. This hasn't been validated. This isn't based on science, you know, so we kind of whittled the list down. And then when we awarded the contract to Perkins & Will and ICF, we whittled it down to a little bit more. So we're now at 63 strategies. that are demonstrated both in literature and research to positively impact the well-being of occupants. And one of the things with FitWell is that in order to keep this affordable, we really focused it on the property management or the facilities management teams, okay? So we really had to think in terms of how does a property manager view their building. So the way we had our strategies originally organized was not how a property manager thinks about their building. So we reorganized them into 12 strategic areas based upon a lot of feedback from property managers that this is how I think about my building, as opposed to how a health professional thinks about health. And these 12 strategic areas all center around 7 health impact categories. So these are the 7 categories. You can see them up there on the screen. So all 63 strategies relate back to one or more of these 7 health impact areas. And then one of the first assignments that the contractors and the expert panel that we convened in Atlanta took on was how do you assign a point value to these different strategies. And so using some previously successful models in LEAD and the CDC scorecard that they did for communities, they basically looked at the impact and the strength of evidence. And so each of the 63 strategies was rated and then has a base score. So once that was developed, we needed to make sure it made sense, right? So we ran a pilot in 2014, and the pilot was not looking at health outcomes. It was looking literally at, does the scorecard make sense to property managers and facilities managers? Does it represent a strategy that they feel they can take on, right? Because again, this FitWell is done by the facilities team. It's not done through, hiring a team of consultants or even relying on possibly having health experts in the building depending on the customer agency. It had to be something that the property manager felt comfortable with. So we created a representative sample of our inventory, which was of 76 GSA-owned buildings. These buildings were from a variety of settings, from historic buildings to modern buildings, different sized buildings, both in square footage as well as the number of people who worked in the buildings. It represented all 11 regions across the country. And then CDC did 9 buildings, and New York City contributed 7. And then after the actual completion of the scorecards, then we did 76 web-based response surveys and 14 in-depth interviews. So the web-based pilot did give us the confidence that we had distributed the point values across the 63 strategies very well. So the statistician was very pleased with these results. So of the buildings that we baselined, 39% were not certified, 29% received a 1-star, 25 approximately percent a 3. Sorry, that should be a 2-star. Just put your finger over that. And FitWell 3 stars were 29%. So a very nice bell-shaped curve. We did do a few tweaks based on input from the property managers. We included a lot more definitions. We included a lot more links to outside resources. So if they didn't understand what a healing garden was, they can click on the scorecard itself and go to the information that describes what we mean by a healing garden or meditative garden. So speaking of challenges, that was one of the tasks of this panel. We definitely had our challenges. I have championed FitWell now for 4 years. There were times when it was literally on the chopping block due to budget constraints, but I must be good at selling it because somehow I kept it alive at all phases. I've been the project manager with FitWell from the beginning, and I'm very proud of the work that we've done. One of the challenges was how do we keep this low cost? Because FitWell is considered a public health program. This will be something that is open to everybody. It's not just a federal program, so when it's ready to go, anybody can access the web portal, anybody can use this process. So that was very important to CDC particularly because their mission is much broader than GSA. We're concerned about our federal inventory and our lease space, but CDC is concerned about everyone, right? They're the public health gurus. So we needed to make sure that we kept that barrier to entry very low so that organizations who didn't have the types of budgets that would allow them to consider this type of process could maybe get into the game. But yet we still wanted to remain high impact and meaningful. We needed to understand what type of operational, technical, and scientific sustainability would be required, and then validity. So I think, we're still working on some of that, but I think we turned a lot of those challenges into opportunities. The certification is designed with the property management in the driving seat, so that obviously helped keep it a low-cost platform. All our strategies are based on science, literature, and expert input. And when FitWell is rolled out to the third-party operator, the government and the original partnership will have a role in FitWell moving forward through scientific review committees and operational steering committees. So we did get the thumbs up over the summer from our commissioner at GSA to roll FitWell out to a third-party independent operator, and that was also very key on keeping it as a low-cost platform. As I mentioned, we wanted to reduce barriers to entry, so keeping it low cost. FitWell will also have a community and education hub, so people who just want to learn about healthy buildings and what you can do in a building is easily accessible and does not require any commitment of money or time. We are going to be building a FitWell community, so people who do go through the certification process can opt in and use FitWell as a way to market their own approaches to making their building healthy, or they can just learn about other buildings and other companies who've done such things. In terms of validity, we're looking at peer reviews, dual signatures, auditing of 3-star ratings, and random audits of 1- and 2-star ratings, but much of this will be determined once the third-party operator has FitWell and is ready to roll. So that's a little bit of a pending issue. So what is our contribution to this wonderful, healthy movement? Well, we're focusing on health outcomes. We very much, today, I hear a lot about indoor air quality, and that's certainly an aspect on the FitWell strategy, but we're also looking at things at a little bit more of a macro level. So things like, do you have healthy concessions and vending? What does your lactation space look like for nursing moms? What does your fitness center offer? Is it managed or is it a standalone facility? What are your emergency procedures? So there's a lot of things that are not really honing in on the very specific science that we've talked about earlier today, but on a more macro level. FitWell is adaptable to all built environments. Right now, the initial scorecard is focusing on existing buildings, but it is very adaptable to new construction, and our design and construction group at GSA is very interested in FitWell, as is our leasing group. So we have a big potential to influence our federal leased space using FitWell as a criteria. It addresses design, operations, and policies. The public health technical knowledge is not a requirement, so again, it's focusing on the property manager and the facility team as being the first step for baselining your building. It's website-based and publicly accessible, and it's a very flexible framework. So right now, FitWell is being trademarked through CDC and HHS through the Office of Technology Transfer. Once that trademark is done, we will be licensing it through that OTT office to an independent third-party operator. And at that point, once they get stood up, that's when basically everyone can access FitWell. So we're anticipating sometime in 2016. Currently at GSA, we're working on our next phase. We're developing a FitWell diagnostic tool in partnership with some other GSA offices. And then we'll be looking at taking the same 76 buildings that we baselined and working on a process for improving those. So wherever their starting point was, how can we move the needle in those facilities to be even better? Or if they weren't able to achieve a rating at all, how can we move them to at least a minimal 1-star rating? Thank you.